Why is nobody deep diving into the importance of talk therapy with psychedelic-assisted psychotherapy? Easy. If you haven't been through the process, you probably don't know how important it is. So let's talk about it. Hi, everybody. My name is Jill. Welcome back to the Journey Sage. And this is the channel that I wish had been around when I was healing my childhood trauma-induced PTSD with psychedelic-assisted psychotherapy. And as I've said before in other videos, the entire process or one cycle for me, and I went through 3 cycles, the percentages of the way that the therapy worked are 40% talk therapy, 20% the actual therapeutic journey with the prescribed psychedelic, and the last 40% integration. Now, I was an English major, but I am good enough that 80% of the process was actually talk therapy. So I want to talk today about the importance of talk therapy before and after the psychedelic assisted psychotherapy journey day. All right, so beforehand, it is incredibly important to have the correct diagnosis. As we're starting to understand with the different clinical trials, there are different psychedelic compounds that work with different diagnoses. In my instance, for PTSD, the primary psychedelic that was used was MDMA. There's a lot of research going on in terms of psilocybin, the ingredient in magic mushrooms, working for depression. So the diagnosis is super, super important. Secondly, the actual treatment that's going to happen. I had lots and lots and lots of conversations with my doctors, my guides, doctors. Remember, I use that term interchangeably in terms of what psychedelic was going to be used. I was never involved in the actual dosages, but there was a lot of conversation about if a booster was needed in the middle of a session. And there was a lot of conversation about my third journey and the potential to need psilocybin on top of MDMA, which ultimately wound up happening. So understanding what the treatment is, for me, it greatly decreased my anxiety and fear around psychedelics, especially for that first journey. And then lastly, you've heard me over and over again talk about the need to set intentions. I mean, heck, I even wrote a workbook about it. So setting your intentions, knowing what your healing goals are or what you want to work on or what behavior change you want or mind shift, those intentions are important. And if you spend I mean, on average, I would spend 2 to 3 months talk therapy before a therapeutic journey. And that made it super, super clear and easy that on the day of the journey, I didn't have any cold feet. I knew exactly what the goals were. I knew what I wanted to accomplish. And I didn't have any of that kind of like second guessing, is this the right intention? Because all of that work had been done before. So that's before the journey. That's the first 40%. The second 40% of the process of talk therapy that I think is super, super important is the integration phase. And in my definition, it's called integration phase because what I was learning about my background, I was relearning my childhood. I was integrating those thoughts and feelings into my everyday life. And eventually, the fear that I had that brought me to the PTSD diagnosis, it just kept decreasing and decreasing and decreasing because I was integrating into my life what I was relearning about my childhood. So one of the things that was incredibly helpful was to be able to talk about my integration, very specifically to be able to talk about the specific reframes. You know, going from my father was kind of a jerk who beat me up to, oh, it totally makes sense how a toddler would think that the universe is out to get her because she can't imagine the fact that her caretaker can't take care of her. And so having my therapist kind of work through some of those reframes with me absolutely sped them up. I think I would have gotten there eventually, but having somebody else mirror what you're saying and having things kind of out there for me was incredibly, incredibly helpful. And then this is a Jill thing. I'm not sure you can tell. I'm a verbal processor. I'm super chatty. So specifically for me, talk therapy was incredibly helpful. I made lots of progress with thinking, walking the dog. I made lots of progress with journaling. I made the most progress talking through some things. So there you go. My impression and why talk therapy is so important to this process. I get it. It's not the spicy side of this therapy. Everyone wants to talk about the whole psychedelic part. But in my experience, the psychedelic part was really only 20% of the entire process. And the actual fireworks of healing, notice I'm doing this because I'm being facetious. The actual leaps and gains and jumps in healing, that was all during the integration and the talk therapy portion. So there you go. If you'd like to hear more about my story, Rescuing Jill, and the Companion Intentions Workbook, they are both on Amazon. Head on over to thejourneysage.com for more information and resources. And as always, any questions, feel free to post them below. Until next time, take care.